from the College by the Lake, Coeur d'Alene, Idaho. Local, regional, national, and international guests discussing the issues and topics affecting the way you live are on Forum, the North Idaho College Public Forum, with your host and moderator, political scientist Tony Stewart.
Welcome to our program. I want to tell you that we're going to discuss today what we believe is a very, very important topic, and that is the question of breast cancer. The statistics are very frightening concerning this particular disease. I would like to quote to you from the National Breast Cancer Coalition. Breast cancer is an epidemic that has been called the nation's best-kept secret. Today, there are 2.6 million women living with breast cancer, another 1.6 million who are being diagnosed, and an estimated 1 million women who do not yet know that they have this disease. This year alone, 182,000 women will be diagnosed with cancer and 1,000 men. And over 46,000 women will die of breast cancer this year. It is the number one killer of women from the ages 32 to 54. Every 3 minutes, a woman is diagnosed with breast cancer. Another very disturbing statistic is that 1 in 8 women will sometime in their life have breast cancer. In order to discuss those very sobering statistics and what we can do in society to reduce the risk of the deaths from breast cancer, I'm very pleased to welcome to our program 2 guests. To my far left is Jody A. Schmidt, who is a staff nurse at the North Idaho Cancer Center in Coeur d'Alene, Idaho. Jody has a bachelor's degree in the field of nursing from the University of Iowa that she received in 1981. Jody, welcome to the program. And next to her is Myrna Bateman, who is the Administrative Director of Oncology Services at the North Idaho Cancer Center, the Kootenai Medical Center. She holds a bachelor's degree in nursing from Langston University in Oklahoma and a master's in nursing from the University of Arkansas that she received in 1991. Myrna, welcome to our program.
Thank you.
And as always, I'm very pleased to have regular panelist Janelle Burke, who's an attorney in the state of Idaho, and I shall ask Janelle to commence the questioning.
Well, Marna, let's begin with you, this very important subject. Tony has indicated some of the facts with regard to the high number of people who have breast cancer, but can you flesh out those facts a little bit and perhaps add some facts, local facts from Idaho or this area? Are these numbers really true? These alarming numbers?
They're very alarming, aren't they, when you hear them in number form? There'll be 550 new cases of breast cancer in the state of Idaho in 1993, and that's 550 cases too many. However, when you look at it on a national level, as Tony pointed out, we'll have 182,000 women diagnosed in 1993 with cancer of the breast. The number that he quoted that is very frustrating to me, I've been in oncology for over 20 years, and it still frustrates me to hear the numbers like 46,000 will die this year from their disease. And you know what's really frightening is that most of those ladies could have been saved had they sought treatment earlier and then complied with the treatment.
Okay, that's the real message today then, is to look at early prevention, early detection,
yes,
and then prevention.
Yes.
Now, Jody, what does it mean to a family when a woman discovers that she has breast cancer, to that woman and to her family?
I think initially it's real devastating. I think people with any type of cancer hear the word cancer, and I think people immediately think it's a death sentence, which isn't so much true anymore. Breast cancer for the woman herself is just a devastating type thing, and often the woman has to have either a lumpectomy or a mastectomy. So it's not only the disease itself, but she's also having an operation that changes her whole body image. So she's dealing with a lot of complex issues, and it's very difficult.
And expense and time away from jobs,
certainly.
I would imagine. Is there any figure, Marna, that tells us how old the average woman is who's diagnosed with with breast cancer? Is it something that hits young women? Is it something that hits older women? Or is there a smattering of all ages
All
involved
ages.
here?
I've seen it in teenagers, and I've seen it in the very elderly women. However, the one, as I told a group earlier today, the one single most common risk factor among women for all types of cancer is age. So as we age, we become more at risk for developing all types of cancer, and especially cancer of the breast.
So that means with regard to detection, it's more important to be aware as we grow older.
Yes.
Later in the program, we're going to get into some preventive methods, and I think that is really the most essential part of this program, and we'll come back to that. But it is also important to educate our viewers that are not familiar with this to some of the theories that exist from some of the research of what causes cancer. I was very disturbed by another statistic, and I'm like Myrna, I do like statistics because I think they tell you an awful lot of things. And one report that I was reading from and I quoted earlier was that we account for about 30% of breast cancer. The other 70% we're not sure of the cause, according again to this organization, the National Breast Cancer Coalition. But Myrna, I will start with you, and would you try to help our viewers in what some scientists have found, and again from that one might change some patterns of behavior that could affect this disease?
There's so many things that we don't know, but I always try to give a positive aspect of anything related to cancer. There's so many things that we know today that we didn't know 5 years ago, 10 years ago. There's a lot of research being completed on our lifestyles, stress, the environment, our dietary habits, and certainly our health patterns. It's estimated by the American Cancer Society that 75 to 80% of all cancers can be related back to our environment. Now that can be our stress level, our jobs, the type of jobs we have, our health habits like smoking, how we eat, lack of exercise, low fiber in our diet, and things like that.
I have a very good friend who's a cancer specialist and a surgeon in Knoxville, Tennessee, and he's been echoing what you're saying for as long as I've known him. In fact, he's written a book on this whole issue, and of course, in his case, he's a colon specialist, and he says the fat in our diet, for example, he is so convinced that it's deposited in just from one serving, like of red meat, that he contains about 40% fat. It takes 3 days to dissolve, and so if it's there all the time, he thinks that creates the tumors. Jody, I would turn to you because I heard you say something earlier today about this whole business, again, of diet and fat and so forth. Along with Myrna, what would you recommend in relation to one's eating habits that also could be directed at the issue of breast cancer?
I think the number one thing, again, is you're talking about the fats, that studies have shown that there is a correlation. And so as a preventative thing that you can do is just try to watch the fats in your diet. There's so many other risk factors that women have no control over, family, history, that type of thing. So whatever you yourself can do to decrease your risk is what you should do.
So if you, again, got more fiber in your diet,
Right.
less fat.
Correct.
Another one's very difficult that Myrna talked about, and that is how do you reduce stress in your life? Do you have any recommendations on how to do that, both on the job and in the family?
I wish I did. Certainly exercise, because and that's what I'm not getting enough of because I'm so involved in my job. But I think we first of all need to recognize that we need to make some life changes, be related to our type of jobs. You know, we have found that certain jobs and certain habits that we have make us even higher risk of developing certain cancers. Certainly people that work around chemicals, chemical factories, and smoke cigarettes have an 85 times higher risk of developing cancers of the bladder and of the lung than other types of people. So I think that we need to take an inward look, not only in how we deal with our stress, but what we're doing to reduce it, either with our eating habits, exercise, job change, whatever.
There's another one area that I want to talk about, and that's the genetic question. I was viewing a national program in which a grandmother and then the mother and I believe 3 daughters had all had breast cancer. What do the studies indicate concerning genetic relationship to breast cancer?
A lot of people have asked me, ladies have said, oh, everybody in my family has some sort of cancer. What do I do about it? Is it hereditary? The research does not prove that it's hereditary, but we do know that it's familial, that it runs in families, that there's something in that gene, there's something in the genetic makeup of those families that causes them to be more susceptible to certain types of cancer. Cancers of the colon, you have what's called familial polyposis that usually runs in the males of families and will be passed on from a father to a son, and it occurs earlier and earlier in that age as that occurs, and usually diagnosed before the age of 30. And then in women, we know that breast cancers, if your grandmother and your mother and sisters and aunts have breast cancer, then you certainly are someone that has a higher risk than the normal population. But when I say higher risk, I want to point out that I don't mean that that's definitely you're going to get cancer. That just means that you have a higher risk of developing cancer than John Doe citizen out here that has no one or no history in his family with cancer.
One final point, going back to Janelle, and you'd indicated in that presentation on the campus today that you believe that in all humans there is the potential for cancer or cancer cells, but there's something that triggers those in some people and not others. Would you comment on studies concerning that issue?
I think we all believe that we have cancer cells floating around in our bodies at some point in our life, but what triggers those cells to start growing? And that is a major emphasis of research. And we're looking at that because whatever, it could be a chronic illness, an accident that causes your body to be overly stressed, or stress over a period of time. There are certain psychosocial scales that have been done on people related to their stress levels or losses in their family due to someone close to them, death. Does that make them at a higher risk? So there are definitely studies going on to prove this or disprove it, whatever. But it is a major concern.
Janelle Berg.
We've talked a little bit about what some of the factors are that might put a person at risk, but now let's talk a little bit about detection. And so let's start again with you, Marna, and what are the things that people need to look for? What do the statistics show us that people need to look for with regard to breast cancer specifically?
Well, first of all, they need to know enough about their own bodies to know when there's a change. And to do that, if you're starting from square one today, you're just going to start. You need to know what's normal for your breast, what you know hasn't changed, the tissue hasn't changed, nothing feels any different than it ever did. And then you need to make sure that you have a physical exam by a physician. And if you have questions about certain things related to your breast tissue or anything else in your body, then you ask a question, you point to it and say, is this normal, is this abnormal, tell me. Then what we recommend is that you make a map, like of your breast tissue, you just make a circle on a piece of paper. And if you have an area that's just really kind of lumpy or whatever, you make a mark on there, and it's in the videotape that we showed today. It says, in your own words, describe what you felt. Take this with you when you go to the physician, say, is this normal? Again, point to that spot. If you get the okay, that everything's fine, then you know that when you feel that, if it hasn't changed, that everything's still okay. But it's knowing enough about what's normal for you, and when something changes, to key into that and seek professional help.
So the number one thing is when there's a change, don't stick your head in the sand.
Right.
Acknowledge the change and point it out to a physician.
Right.
Okay. So now, what do we do next?
Okay, you've had your, you know what's normal for you. You've kind of had the start for the physician. He says everything's okay. Then you need to get on a schedule for breast self-exam. And that could be, depending on if you're premenopausal, you're still having menstrual periods, then you'd need to go by the day in your cycle. And they usually recommend that it's 2 to 3 days following the beginning or the end of your menstrual cycle, your menstrual period. If you're postmenopausal, then you need to make sure that you do your exam monthly, the same day every month, like the payday, the first of the month, your birthday, whatever, and get on a cycle at that point. Then you also need, depending on your age, need to have a baseline mammogram, because with a mammography, you can find lesions as small as a freckle. And if you're doing all three of these things, then you've got a pretty good chance of being aware when there's even minor changes. And 85% of the lesions are found by the lady themselves.
So, Jody, what are some of the other things now that you might look for? We've talked about some really good detection process here, but what are some other things that if someone sees a change, that the kind of change that might alarm someone that would bring them in?
When you do the breast self-exam, not only are you you're feeling for lumps, but you're also, part of the exam is to actually visually look at yourself in a mirror. And when you do that, you're looking for, is there any puckering of the skin, any pulling? If there's a tumor or anything underneath, it can cause the skin to pull down. That's what you're looking for. Women also have to examine their nipple. Is there any strange discharge from there? You need to let your physician know. Is there any scaling around the nipple? Is there any discharge, or is there any redness? Is the skin red? There's a different type of breast cancer. We always think of breast cancer as being a lump, but there's also a breast cancer called inflammatory breast cancer that looks more like your skin is just swollen and angry red, and there isn't often a lump under there. So if you have any of those kind of changes, it's really important. Go see your physician.
What about soreness and tenderness? Is it necessary to have soreness and tenderness in order for this to be a problem? And perhaps someone says, I've got a lump, but it's not sore, and therefore it's not important.
Not
what would you say about that?
Not necessarily. You can have cancer can be there and not be sore. And so if it's just a lump and it's not been there before, that needs to be attended to.
Now, do you have anything to add here? Those are the major things that people should be looking for in the detection process.
Mm-hmm. I think that one of the things that we discussed today in the class that we taught, and by the way, a little commercial here, is that we are available to teach these classes to any civic groups, church groups, any kind of ladies group. You can call us at the North Idaho Cancer Center and through the assistance of the American Cancer Society and Kootenai Medical Center. We'll be on the road with our show.
Well, let me interrupt here to say that some of the people are outside, obviously, of our telephone directory. Why don't you give them a telephone number, because they also you may be able to direct them to someone else, somewhere else.
Any state other than Idaho and outside of this region, they can contact their local unit of the American Cancer Society, and through the American Cancer Society they can have breast self-exam classes brought to their businesses or homes.
If you don't mind, we'll also let you give a telephone number. We're in area code 208.
208-667-8818.
I'm sorry to interrupt. I want
That's
to
okay.
serve our viewers in that way.
That's right. We just want them to call, and if they have questions in general, they can call the 800 number for the American Cancer Society, and those are for general questions, and it's a call 1-800-4, the number 4, cancer.
That is really most helpful. You both did such a professional job, an outstanding job today in presenting at the class that we've been referring to on this program. To be of even greater assistance to our viewers, you indicated, as you have here, that this self-examination should take place once a month for many of the women. Also, you made a point today that I think is terribly important, and that is that actually breast cancer increases by age, and so older women shouldn't assume that they have surpassed the danger. But you also was very, very good in talking about the examination. Myrna, I would like to have you to take them through that. It's just not. There's different positions where you're lying down and so forth. If you would take them through what you'd recommend, which is about a 10-minute period for the examination, I think it'd be helpful. And I also would like to urge you to bring in the clock as an example.
Okay.
Because
I'm going to defer that to Jody because she's the one that taught that part.
Well, fine. Jody, would you do that for us?
There's 3 parts for an exam. What a woman needs to do is, first of all, they recommend that you lay down on your bed and even take a small pillow or a towel and fold it up. Lay down, and what we really recommend is you get some lotion or oil, because then your hand slides better. And what you need to do is you need to be real systematic. You need to use not the tips of your fingers but the pads of your fingers, and you need to the best thing is probably to do a clock. Think of your breast as a clock and start at like the 12 o'clock position and just start circle, circle, shift, circle, circle, shift, never lifting your fingers up, and just do a complete circle and then keep rotating in until you've done the entire breast. If you feel anything strange, we recommend you use a map. Actually, Marna was talking before of drawing a picture. If you feel any lumps, anything strange, mark it on the map, take it to your physician. You do this with both breasts, and the thing that's real important for women to remember is that your breast, a lot of women forget, your breast goes all the way from your breastbone into your armpit. You've got lymph nodes in your armpit, and that's real important to remember those, because if breast cancer is going to spread, it really likes to go into those lymph nodes. So to do the entire breast, you repeat the same thing on the other side. Then the woman gets up, goes to a mirror, and you need to actually visualize yourself in the mirror and examine your breasts. Shift from side to side, look at your breasts from all positions. Then they recommend that you take your hands and you put them up above your head. And that's important because sometimes if there's a tumor and you were looking for that dimpling when we're doing this, sometimes it doesn't show up until you've got your hands up, you've shifted position. Then also put your hands on your hips, put your arms forward, stand in front of the mirror, and again turn from side to side. You're looking to see any changes. Then the third thing that the woman needs to do is examine herself in the shower. That's because you're standing up. Sometimes lumps can't be felt when you're laying down, but can be felt when they're in the shower. And again, you're using soap at that time because your hand will go better, slip along the breast better so you can feel better. And it's real important to not ever lift your hand up. You want to do the entire breast. Sometimes if you lift your hand up, you forget where you were at. And the other real important thing is to do it at the same time every month. I think it's like putting your seatbelts on in your car. If you do it all the time, it just becomes automatic, and you just do it. And it's what you can do to help yourself.
I do recall during the presentation that Marna said that also that you've done an excellent job, Jody, as you've described that, but that some women find it more comfortable to do it another way other than the way that Jody has explained. Would you like to briefly mention that?
Well, you can do it the wedge method, where you could go just like the wedge on a pie. You can do that. The diagonal, where you could go at the top and just work down and just work up and down all the way across the breast. But not forgetting the axilla or the armpit, because that is something that we tend to forget when we do that, and just not to take your hands off of your breast tissue or off the skin doing that, because again, like Jody said, you will lose your place, and it might be the spot you don't want to forget.
There's one other thing that I want to get before going back to Janelle, and in the presentation, the video that you had, also indicating again for women who might be just starting these self-examinations, realize that different parts of the breast consist of somewhat different tissue and so forth. Which one of you would like to take that and explain that?
There are different, your breast is made up of lots of different tissues. It's made up of fatty tissue. The bottom part of your breast tends to be more fatty, so it's going to feel different. It's also made up of glandular tissue. That's what makes the milk. So you'll feel that. Some women can even feel the fibrous tissue in there. Your breast is made up of ligaments that hold up your breasts. Some larger breasted women actually have a ridge underneath the breast that they can feel, and that's real disconcerting to women when they do this for the first time. They think, oh my word, what is that? But that's real normal. But if you do this for the first time and what you feel, you don't know if it's normal, check with a physician. And also women that are real small-breasted can feel their ribs. So you feel all sorts of different things.
I think Myrna put it so well earlier, you got to get to know your own body and your own system, and a physician can be very helpful the first time around, so then you get familiar with all of those different.
And we've had a lot of questions or comments throughout the years that they say, well, I go to a physician every year. I mean, why should I do it? And I always remind them that physician is examining hundreds of people. And why would you expect that physician to remember exactly what's going on in your breast tissue? You're the one that should be finding it, questioning, and pointing it out to that physician when you have a question. Take responsibility for your own body. And I said if women will wake up and begin to ask questions and insist that they're being cared for properly, then we'll have a lot better health.
That's an excellent point to make.
Get off my soapbox.
That's excellent. That's excellent. And a lot of physicians will tell both men and women, you know more about your body than anyone else. It's just like eating things. Some people are allergic to certain things, and you need to communicate that also with a physician. Janelle Berg.
We've talked a little bit about detection now, so now let's talk a little bit about the next step, prevention, although detection, of course, is prevention. But now let's talk about health in the case that you should discover something. What kind of encouraging news can you give women as compared to 5 years ago, say, for example? Or what kind of encouraging news can you give them if it's an early detection as opposed to a late detection? Let's start with Marna, and then Jody may have some things to add.
Well, again, I'd like for people to focus on the positive aspects. I cannot tell you the changes that have occurred in the years that I've been involved. And one thing that I like to point out is that the 5-year survival rate, which used to be the magic number that everybody reached for, in 1940 we had a 78% 5-year survival rate among women who were diagnosed with cancer of the breast. Today, in 1993, we have a 93% 5-year survival rate. We're getting well past the 5 years. In fact, in cancer in general, we're having new problems to deal with that we've never had to deal with before.
So that's the good news, and that's the early detection can really help. Jody, what does that mean in terms of the woman's lifestyle?
Oh, well, certainly it's, when we were asking before, how does it affect the woman, it's much brighter outlook that if there's early detection, it's localized disease, then certainly they have a lot to look forward to. 93% are going to go on and survive. So, you know, even though a lot of these women will have to have lumpectomies or a mastectomy and have some chemotherapy, still their outlook is wonderful. They've got a lot going for them.
And so that is generally the way it's treated now, not radiation, but generally it's a surgical removal of the lump if that's possible.
Well,
first.
Right. If they have a lumpectomy, then it's also recommended they have radiation afterwards, just in case, to get localized control if there would be any cancer that was not detected. If they have a modified radical mastectomy, then no, they don't have radiation as a rule at that point.
And then they would use a chemotherapy afterwards in some cases.
In some cases, correct.
You know, our first, we have several reasons to treat people. And first of all, we want to say that 100% of them will be cured. That's not always the case, so we go to the second step when we do what's called adjunctive treatment or prophylactic treatment. That can be radiation therapy or chemotherapy, hormonal therapy, whatever. And that's, we think we got it all, we're pretty sure we got it all, but just in case, we're going to go ahead and follow up with this chemotherapy regime. There's a lot of controversy out now about the tamoxifen versus no tamoxifen and things like that.
I'm so sorry to interrupt, but we're out of time. The clock always wins on this program. Thank you both for being here. You've been most informative, and I know you've been of great assistance to our viewers. We thank you very much. Ladies and gentlemen, we've been discussing what I'm sure you'll agree is an extremely important topic, and we've tried to be very helpful, and we hope you'll be with us again next week when again we will discuss an important issue. Until then, please have a good week. I am Tony Stewart.
The North Idaho College Public Forum was videotaped live from the studios of Telemedia Services on the campus of North Idaho College for viewing at this more appropriate time. We invite you to join us again next week for another all-new edition of the North Idaho College Public Forum on this public television station.